Hello everyone, I'm Dr. Sean, a sports orthopedic surgeon committed to helping you move freely and comfortably. Today, I want to share with you some exciting advancements in treating cartilage injuries, specifically something called AMIC, and how it could be a game changer for you. You might be wondering, what exactly is AMIC? It stands for Autologous Matrix-Induced Chondrogenesis. But let's break that down to simpler terms. First, let's talk about why cartilage injuries can be so troublesome. Cartilage, the smooth rubbery tissue that cushions your joints, doesn't have its own blood supply. This means it struggles to heal itself when damaged, often leading to persistent pain and limited mobility. Traditionally, we have used a technique called microfracture surgery. This involves creating tiny holes in the bone beneath the damaged cartilage to stimulate the release of stem cells from the bone marrow. These stem cells can help grow new cartilage. While this method can be effective, sometimes the healing isn't as robust or long-lasting as we hope. Now that's where AMIC comes in. Imagine you're repairing a road. Instead of just filling up the potholes, you lay down a special mat that not only fills the gap, but also provides a stable foundation for the road to rebuild itself more effectively. Similarly, AMIC uses a scaffold, like a biochamber, to cover the area where the cartilage was damaged. This scaffold holds stem cells in place, creating an optimal environment for them to grow and regenerate stronger, healthier cartilage. Why is this important? By containing the stem cells within the scaffold, we enhance their ability to repair the cartilage more effectively than traditional microfracture alone. This means better healing, more durable cartilage, and a higher chance of returning to your favorite activities without pain. What's even more exciting is that this approach is done through a single procedure. There is no need to harvest cartilage and grow them in the lab for several weeks, which is a common practice for other methods like autologous chondrocyte implantation. This means fewer surgeries and a more straightforward path to recovery. By combining your body's natural healing abilities with advanced medical technology, AMIC offers a promising solution to restore joint function and reduce pain. Imagine getting back to your favorite activities sooner with more confidence. While AMIC is relatively new compared to traditional methods like microfracture alone, ongoing research continues to refine its long-term effectiveness, and early results are highly promising. This innovative approach offers a viable option for those looking to restore their cartilage and get back to an active lifestyle. Many patients are already experiencing these benefits. Recovery time can vary depending on individual circumstances. Many patients begin their rehabilitation shortly after the surgery and can return to normal activities within a few months, thanks to the enhanced healing processes. If you've been struggling with cartilage injuries or knee pain, now is the excellent time to consider your treatment options. Taking actions today could set you on a path to better mobility and an improved quality of life. Your journey to healthier joints starts here.